High Definition News updated for Tuesday, October 28th, 2014. I'm Jeff Kaufman.
As a nurse, and now as someone who has experienced what it's like to be cared for through a life-threatening illness, I am so appreciative and grateful for your exceptional skill, warmth, and care.
Amber Vinson thanks the doctors, nurses, and researchers at Emory University Medical Center in Atlanta as she is released from the hospital, the latest American healthcare worker to be cured of Ebola. Vinson was the second of two nurses to come down with Ebola after being part of the team that cared for the only person to die of Ebola inside the United States, Thomas Duncan. That was at Texas Health Presbyterian Hospital in Dallas. Vinson was flown to Emory in Atlanta, which had experience treating two American missionaries who were infected treating Ebola patients in West Africa, where the outbreak has sickened more than 10,000 people and killed half of them.
While this is a day for celebration and gratitude, I ask that we not lose focus on the thousands of families who continue to labor under the burden of this disease in West Africa. Thank you to Dr. Kent Brantley and Nancy Wright-Ball, both of whom were successfully treated here at Emory, for your donations of plasma for me and other patients. And thank you for your leadership in helping to educate the public about this difficult but treatable disease.
In Africa, Ebola's toll is measured in bodies and heartache. In the U.S., though, so far Ebola's toll has been measured in politics and fear, most of it unfounded. Case in point, Casey Hickox, the healthcare worker who was confined to a tent in the parking lot of a Newark hospital, without plumbing, without clothing except for a paper hospital gown, despite the fact that Hickox was without symptoms upon her return to the U.S. after caring for Ebola patients in West Africa. That was under a policy instituted by New Jersey Governor Chris Christie, who told a news conference Hickox looked obviously ill when she returned from Africa. She was not ill. Casey Hickox is back home tonight in Fort Kent, Maine, near the Canadian border. She was released from that quarantine after she began a public relations campaign Sunday morning on CNN's State of the Union.
The first thing I would say to Governor Christie is that I wish that he would be more careful about his statements related to my medical condition. I am not, as he said, quote, unquote, obviously ill. I am completely healthy and with no symptoms. And if he knew anything about Ebola, he would know that asymptomatic people are not infectious. I understand that people feel like they have a risk, and I think we can have a conversation about what further measures might look like. But I think this is an extreme that is really unacceptable, and I feel like my basic human rights have been violated.
Less than 24 hours later, Governor Christie backed down and ordered her release. Hickox will be in isolation at her boyfriend's home for the incubation period of Ebola, 21 days. Her attorney, Norman Siegel, told CNN this morning that the handling of her case is no way to inspire public confidence in the government's ability to respond to a health emergency.
If it turns out that her temperature is normal, she has no symptoms of the disease, there's no reason for her to be restricted. If there are symptoms, then you deal with it differently. I'm not opposed to the fact that the government has the power to use quarantine. They just have to do it correctly, and so far, we've bungled it.
But Governor Christie was having none of it this morning. He told Matt Lauer on the Today Show that he was right and he would do it again.
When they're in direct contact with people actively with the Ebola virus, asking them to quarantine at home for 21 days, unless they're symptomatic, I don't think is draconian. And I think Dr. Fauci is responding, unfortunately, as are many of the people from the CDC, in a really hyperbolic way because they've been wrong before. And now they're incrementally taking steps towards the policy that we put in effect in New Jersey, and now 6 other states have put effect, and the Joint Chiefs of Staff have put in effect. I mean, we're all wrong, and they're right, Matt. We're trying to be careful here. This is common sense, and the members of the American public believe it is common sense, and we're not moving an inch. Our policy hasn't changed, and our policy will not change.
On his way to a campaign appearance this afternoon in Wisconsin, President Obama stepped before the microphones on the White House lawn, and while he did not mention Governor Christie specifically, he seemed to have him in mind.
When we have volunteers who are taking time out from their families, from their loved ones, and so forth, to go over there because they have very particular expertise to tackle a very difficult job, we want to make sure that when they come back that we are prudent, that we are making sure that they are not at risk themselves or at risk of spreading the disease. But we don't want to do things that aren't based on science and best practices, because if they are successful, then we're not going to have to worry about Ebola here at home.
They think they have found patient 0 in this current Ebola outbreak, and 0 is not too far from his age. The first Ebola victim is thought to be a 2-year-old boy who died a year ago in southern Guinea. The disease also killed his mom, his sister, and his grandma, and epidemiologists think that the virus began its wide spread at his grandma's funeral. Fear has been so much a part of this Ebola outbreak. So in Orange County last night, UC Irvine invited people from the community in to hear not from politicians or commentators or even highly conscientious radio news reporters.
I have never heard or seen such outrageous, frantic, hysterical, vicious, distorted reporting. I'm not blaming anybody for that.
All right, you. Halloween's not till Friday. To hear from medical experts like the university's Michael Buckmeyer, an expert in infectious diseases.
What we're preparing for is a disease that is terrifying, that may seem uncontrollable, but is eventually. That what we really have to do is stay calm.
One way to stay calm about Ebola is to make sure that you don't catch anything that has symptoms that at first are just like Ebola's. And the best way to do that is to get a flu shot. See what I did there? The LA County Health Department is making it even easier for you this year by expanding the number of places you can get a free flu shot to include public libraries, as well as the traditional clinics and hospitals. You can find out more by calling 211 in LA County or clicking yourself over to publichealth.lacounty.gov. Not now, when the news is over. If your holiday gifts are a few days late this year, don't blame Santa or the non-union elves working for a non-living wage in the sweatshops of the North Pole. Blame congestion at Long Beach Harbor. Some shippers report their goods have been delayed between 2 and 3 weeks. Remember, it's still October, a long way to go before Christmas. This trucking company executive told Channel 2 that he cannot even get his trucks into the port at the LBC.
For me, it's very frustrating. My customers are pulling their hair out. I'm turning down 20 calls a day. We have enough trucks to service the industry. It's the port congestion and the long visit times that the trucks experience that are creating most of the delays.
You might want to put out something a little stronger than milk and cookies for Santa on Christmas Eve. He might need it.
Welcome back.
Baby boomers lost another of their TV moms last week. Marcia Strassman played the wife of the title character in the 1970s sitcom Welcome Back, Kotter, which may be most famous today for launching the career of John Travolta, who played one of the sweat hogs, the semi-delinquents with hearts of gold who made up the class taught by Mr. Kotter. Kotter was played by Gabe Kaplan. Marcia Strassman also starred in Honey, I Shrunk the Kids. She was 66 when she died at home in Sherman Oaks on Friday of cancer.
We got him on the spot. Welcome back.
Now you know what we know. I'm Jeff Kaufman, High Definition News.